Thank you for coming in today, Sergio. So what we're going to be doing today is we're going to be building a treatment plan for you. The way we're going to be doing that is by looking at your aging process. We'll also be looking at your unique anatomy. Based on that, we're going to be coming up with a diagnosis. With that diagnosis, we then come up with a comprehensive treatment plan that we will work at slowly to get you to a place where you would like to be in terms of your appearance and working on some of your concerns. Now, can you tell me a little bit about some of the concerns you have?
First concern is just the bag under my eyes. I just feel like I'm constantly just looking really tired, so I want more like a refreshed look. I've actually never gotten Botox before, so I'm actually considering doing Botox, especially in my forehead. But I feel like the wrinkles now are a little bit more pronounced, so I want to soften that look. And maybe something to do with my jaw. I kind of want a more pronounced jaw, but not change my face completely.
Okay. Some of the concerns you have are very common with a lot of patients that we have. So let's talk a little bit about them. And what I'm going to do is look closer at your anatomy, and based on those factors, we'll come up with a treatment plan.
Awesome.
Do you mind if I touch your face?
Yeah, you go for it.
Okay. Bite down for me. Great. Okay, I'm gonna have you do a few facial movements.
Okay.
Raise your eyebrows up for me. Close tight, tight, tight. And I want you to give me a strong neck where you, yep, perfect. Let's look at your pictures. Okay, Sergio, this is your 3D symmetry model. We really like looking at these pictures because it tells us a lot about your asymmetries. So this here is a picture of you. This is what you look like. This is you with two left sides pasted together. This is you with two right sides pasted together. The one thing that's very interesting about these three pictures is that all three of them are quite similar. This tells us that you are quite symmetric, and we don't have a lot of work to do in terms of creating symmetry to your face. Let's look at your oblique, 3D oblique. This tells us a lot about the angle and prominence of the cheekbone. So if you look here, you're a little flat here in the cheekbone. That's one reason I want to create a little more structure to the cheek, is to lift up the tissues in the face. You do have a little bit of a puff here. So if we create structure, it lifts up on tissues to the lower face. And it goes for both sides of your face. Okay. That's why we really like looking at this 3D portion, the oblique portion of the 3D model. Let's look at your grayscale. This tells us a lot about volume and where you have some deficiencies. So when we look at this, we can see that you do have deficiency under both eyes, a little more on this side compared to this side. So we can use filler to restore the fat and bone that you have lost. Other than that, the volume to your face is quite nice. One thing we want to work on first is treating your brow by giving you lift to the brow. We also want to treat some of the fine lines in your forehead. The way we do that is by using Botox to give you lift to the brow, maintain symmetry, but also soften some of the fine lines you have. You do have a very strong neck, and we are a bit forward thinking with you. We want to maintain the jawline that you have, so we would treat your neck with Botox so that it doesn't engage and pull down on the lower tissues of the face. Moving on to your filler treatment, we would put filler to the under eye to give a more rested appearance to the under eye. We could also help improve some of the dark circles under your eyes. Okay. We can use a calcium filler to build out the jawline a little bit to make it more defined and sharp. Right, Sergio, so that is what I have for you in terms of your comprehensive treatment plan. That is something that we will work at a pace that you're comfortable with and a pace that we feel would be best for you. Okay. Do you have any questions or concerns about anything we've discussed at this point?
Yeah, just a couple questions about the downtime. Since I have a full-time job, I can't really take that much time off, so I'm wondering what the recovery time will be.
In terms of downtime, there's going to be virtually no or very little downtime with your treatment. That's generally why we start with Botox, because there is no downtime and it's most cost-effective. So in terms of downtime, Botox is not a concern. With the filler, we use a cannula technique, which allows us to put the filler directly on bone, minimizing both bruising and swelling. So that is one thing you don't have to worry about. You could do both the filler and the Botox today and be able to go to any plans you have this evening or work tomorrow.
Oh, that's great.